Hello and welcome to our presentation for the culturally competent care of the Latino patient. Transcultural Healthcare, Nursing 480, Summer 2, University of North Carolina, Wilmington. Members of our group include Brandy Bass, Allison Buckner, Emma Hussey, Kendra Jones, myself, Stephen Jones Jr., Karen Newsom, and Mary Wren. Our introduction to the Latino culture includes that Latinos are a diverse and ethnic group. Latino refers to all persons living in the United States whose origins can be traced to the Spanish-speaking regions of Latin America. Those regions include the Caribbean, Mexico, Central and South America. They comprise 16% of the U.S. population, which is the largest minority group. The Latino population is projected to grow to 30% of the U.S. population by 2050. They are the three largest subgroups of U.S. Latino population. They consist of the Mexican Americans at around 65%, Puerto Ricans at 9.1%, and Cuban Americans at 3.5%. Latino patients face a number of barriers to culturally competent care. They include language, the inability to afford proper health insurance, fears of deportation, and illiteracy. Cultural attributes include group-oriented culture. Familismo is a strong sense of identification with and loyalty to their nuclear and extended family. Individuals are not to make decisions without consulting the family. Family members are usually present during medical appointments, hospitalizations, and other procedures. Respecto, respect. Each person is to defer to those in a position of authority because of age, gender, social position, economic status, and title. Healthcare providers are viewed as authority figures. Cultural attributes also include fatalismo. That's the belief that individuals can do very little to alter their fate. Latino patients are more likely to believe that a chronic disease such as cancer is a death sentence. They prefer not to know if they have cancer. Latinos may be less likely to seek preventative screenings and may delay treatment until symptoms are severe enough to do so or warrant such things. Machismo is Latino men are expected to be providers, and they are to maintain integrity of the family unit and uphold the family honor. Simpatia, which means kindness. Latinos are more focused on relationship versus being time and task oriented. They also have an emphasis on politeness and conflict avoidance. Personalismo means formal friendliness. If a healthcare provider seems hurried or detached, the Latino patient may feel dissatisfied with the care provided. Views on health and disease. Diverse views on health and illness exist throughout the culture. Traditional Latinos may define health holistically as a balance in the physical, environmental, social, and emotional aspects of an individual's life. Fatalistic belief that illness is God's will or divine punishment brought about by previous or current sinful behavior is also viewed. They also see supernatural forces such as magic, evil spirits, the evil eye, and witchcraft as a hindrance or cause and effect on their health outcomes. Poor health or illness may be attributed to imbalances in the hot and cold properties of the body. Such causes include improper intake of hot or cold foods, exposure to temperature extremes, drafts or dust. We'll talk about this a little bit later. Susto is the belief in illness caused by envy, anger, fear, fright, or excessive worry. Curanderismo is folk healing tradition present in Mexico and Latin America. Curanderos is the traditional healers who receive their talents from God or through apprenticeship. Distinguishing between those hot and cold illnesses, as referred to earlier. An example of a hot illness would be something like hypertension, diaper rash, or diabetes. A cold illness would include things like a headache, pneumonia, or other upper respiratory infections. Santeria is a folk healing tradition that is present in Brazil and Cuba. Yerbares, or an herbalist, is a significant number of Latinos utilize these home remedies and or seek treatment by traditional healers in conjunction with the use of conventional medical treatment. Hueseros, a bone setter, or parteros, a midwife, are also other disciplines that can be used within the traditional holistic healing methods mentioned before in the slides. A physical therapist, also referred to as a sobradores, can be utilized. Culturally sensitive nursing care for childbearing women and their families. Important things to remember here include the language barriers and the inability to afford the health care that may deter these patients from seeking health care. All right? It's important that we utilize interpreters and that we educate patients of the financial resources available and other social services. Diabetes, hypertension, and obesity are increasingly more common in Latino culture, as we have seen. It's important that we educate about the consequences of the untreated diabetes and hypertension, that we provide the preventative education necessary to the adolescent and young adult populations, that we educate proper monitoring techniques and when to seek physician help, that we educate about proper diet and exercise routines, and that their medication instructions and regimens are followed through fully. Family conflict and burden can lead to a higher risk of psychological distress in Latino women. It's important that we assess a patient's mental status for signs and symptoms of depression here. Machismo, or the male dominance role, can also lead to family violence, as the woman tends to be more submissive in the Latino culture. We are to assess the women and children for signs and symptoms of abuse. Folk medicine and herbal remedies are often used in the Latino culture. The patient may be hesitant to mention these remedies as they conflict with modern medicine. So it's very important specifically that we assess the use of the herbal remedies and if there's any interaction with modern drug that we may prescribe during their hospital stay or post-hospital regime. Important things to consider when dealing with Hispanic children between the ages of 0 and 17. Let's note that Latinos initiate and engage in risky behaviors such as carrying a weapon, getting into fights, smoking, drinking, and using illicit drugs at earlier ages and are more often compared with other groups of adolescents. Latina girls have the highest rate of teenage pregnancy of any ethnic group, with more than half of Latinas bearing a child before the age of 20. Latina boys enter the juvenile justice system at a disproportionately higher rate than their peers. Hispanic adults ages 18 to 64. According to the 2010 U.S. Census, there were approximately 50 million Hispanic or Latino Americans in the U.S., with roughly half of those, or about 25 million, being between the ages of 18 and 64. That's according to the U.S. Census. Leading causes of illness and death in the Hispanic adults: heart disease. Risk factors that include the prevalence of diabetes mellitus, metabolic syndromes, obesity, hypertension, and sleep disorders that affect breathing. Education should include signs and symptoms of these risk factors and lifestyle changes necessary to lessen these risks. Cancers. Hispanics are less likely than non-Hispanic whites to be diagnosed with the most common cancers, but have a higher risk for cancers associated with infectious agents, such as the liver, stomach, and cervical cancers. Education should include the importance of regular health screenings, such as pap smears. Other unintentional injuries are also a major cause of illness and death. Causative factors include higher Hispanic employment rates in dangerous industries such as construction and agriculture, as well as inappropriate and ineffective training for Hispanic workers. Education should include the importance of knowing proper job training and their workers' rights. Diabetes. Risk factors include obesity, hypertension, high cholesterol, and cigarette smoking. Education should focus on the importance of lifestyle changes, such as weight loss and smoking cessation. Hypertension and stroke. Causative factors include obesity, smoking, and unhealthy diet. Education should include the importance of regular health checkups, lifestyle changes related to risk factors, as well as signs and symptoms of high blood pressure and stroke. Barriers to proper health care for Hispanic adults. Poverty. The poverty rate of 23.6% for Hispanics is more than double that of non-Hispanic whites. A lack of usual source of care. 34.3% of Hispanic Latinos do not have a primary care provider. A lack of insurance. 23.6% of Hispanics under the age of 65 do not have health insurance. Language barriers. Lack of understanding of English leads to Hispanics being unable to communicate their needs, as well as their inability to understand public sources of information about health. Assisting the Hispanic adults in receiving appropriate health care. 1. We should have Spanish-speaking persons on staff or have the ability to access to interpreters. We should provide all patient information, education, and community resources in Spanish. We should provide education about illnesses that are prevalent in the Hispanic community. We should provide information about what services are available regardless of insurance or documentation status. And we should provide information about all low-cost or free medical clinics that are available, as well as all low-cost medications available as well. Culturally sensitive nursing care for the older adults. The Hispanic individuals are less likely to use preventative care, such as cancer screenings and vaccinations. We should educate our Latino patients on the benefits of preventative care and the importance of diagnosis for early interventions, which can lead to a better outcome. They are less likely to use long-term care or home care than non-Hispanic older adults because the family wishes to care for them. This is our familialism. Include education to Latino older patients that long-term care is not a replacement of family care, but an assistance to it, and that if emergency should arise, healthcare assistance would be well equipped and readily available. Latino patients will make decisions involving the family instead of independently, and the oldest male usually acts as a spokesperson. We should include the family in the interdisciplinary meetings and treat them as one patient. Show respect to the entire family to form trust. It is important to allow patients to speak for themselves in private if they wish. We should also allow, although familialism is important to most Latino households, we are to not assume that it is the case for every Latino patient. Approximately 40% of Hispanic older adults experience abuse or neglect within 1 year's time. Few report this to their healthcare clinicians. We should assess for signs and symptoms of abuse or neglect and ask if maltreatment occurs in the home, but understand that the patient may be silent about this issue. Quote, fostering trust with Hispanic older adults is important. They should understand that the role of the clinician is to help rather than harm them. Savage, Foley, Edwards, and Abramson. 2016, page 26. The needs of the Latino communities need to be individualized for their needs. The federal government can help eligible Hispanics get insurance coverage through the Affordable Care Act. We can work to build capacity in communities to use community health workers to help improve the health of Hispanic communities. We can individualize existing programs to improve community health services and to access the preventative care there. We should also make efforts to better represent all Hispanics in national health surveillance data and research studies and use the data to help improve Hispanic health. Pamphlets and handouts need to be available in Spanish. We need interpreters available at all doctors' offices. We need to educate the community on available resources and assistance programs. Pontevelas, similar to comic books, use plain language to educate. Amigas is an educational outreach information that we should also think to utilize. In summary, to sum everything up, we can all agree that Latinos face many challenges due to economic and social issues. Generally, Latinos are very family-oriented and usually very religious as well. Oftentimes, these family and religious values don't mix with modern medicine or healthcare, but we have learned that these barriers can be overcome through education and communication. Understanding and respecting Latino cultures, beliefs, and values, along with proper communication, will allow healthcare workers to provide the highest quality care necessary. No particular race is the enemy, only ignorance. George Lopez. Here's a list of our references. As you can see, no reference left unturned. Thank you very much for listening to our presentation. We hope you've enjoyed it.